So it's a bit of a long story.
Yeah, well, I can't imagine going through, you're at a group home working with at-risk individuals, and you're there as a conduit to help them, and you get a phone call stating, we don't even know how you're alive right now and functioning. We
Yeah.
have to get you to the hospital to get you some help. And the words leukemia, cancer, different things start popping up. What went through your mind?
Welcome to the Recovery Roundtable podcast, where the journey to sobriety opens up through powerful discussions and shared experiences. Join your host, Mark, who will bring you stories of triumph and resilience from the heart of Pacific Shores recovery. Every episode offers insights and support, guiding you through the challenges of addiction recovery. Thank you for joining our community. If you're ready to start or continue your recovery journey, we're here to inspire and support you. Let's explore recovery together.
Well, Geordy, it is awesome getting to officially meet you in the Matrix. And right before we jumped on, you were reminding me how we know each other. We actually belong to a community of other entrepreneurs and business individuals, and it's just amazing seeing what people are doing in this world. Why don't you go ahead and introduce yourself and what you do?
Yeah. So my name is Geordy Murphy, and I'm a registered psychologist in St. Albert, Alberta, Canada, for those of you who don't know. And I work with a lot of men dealing with trauma and anxiety, depression, uh, and a lot of relationship issues. And so with that, I do some Gottman work as well, so working with couples and because I find a lot of people's trauma gets mixed into relational issues. We see that a lot. So I find myself working a lot with men specifically. I get a lot of men coming to me, a lot of wives and girlfriends giving me a call to see if their partner can get help. So yeah, so that's what I do. Yeah, so I'm just growing my practice right now. I have a group practice in St. Albert, and we're growing and helping people. So it's awesome.
How long have you been in the field of psychology with your practice?
So, as a psychologist, I've been working for about 3 years, and then as a practitioner since about 2016. So, for about 9 years. So,
Okay. And so what got you interested in the psychology field of wanting to help people were your parents psychologists? Did you have some issues growing
uh,
up?
well, so my journey started in just around like 2000, in the early 2000s, actually, um, where I was actually training to be a pastor, believe it or not. And so I went to Bible school, and I was all ready to. I felt like this was my calling to work in the church and reach out to people. And I found myself. I was working in homeless shelters, and throughout that journey, I found that as I was working with people on the street, I found I was a lot better at the one-on-one. So people would come to me, and we would be chatting, and I found my skill set was more in the one-on-one. So I was like, I need to really start looking into this. And I just started developing a passion for people, and it had to go beyond the spiritual because there are people with all kinds of issues that I wasn't equipped to working with them, right? And so like I got to learn some psychology and add it to the mix, right? So that's kind of where it started. So that's quite a long time ago.
Yeah, well, that's something that we see quite often in this field is the individual either has a really big heart of wanting to help people because something happened to them when they were a kid, or they're just trying to go through their own journey to heal. Once they heal, they find
Right.
out, oh my gosh, there's tools and strategies, and I can become a conduit to help other people heal. So it sounds like you
Totally.
started first down the pastoral route of wanting to help men's souls. It sounds like what led you to that calling?
Yeah. So leading to that calling of helping men. So moving on. So my journey I just kept on pursuing psychology and just learning more about it. I I had to upgrade like crazy because none of my credentials were accepted because I went to a Bible school and like none of the stuff got accepted. So I had to basically upgrade everything. And then as I was doing my master's degree in 2014, I ended up actually getting diagnosed with severe aplastic anemia, which I don't know if you know what that is,
No, what is that?
but it's a bone marrow, so it's a bone marrow failure disorder. And so I ended up having this huge crisis in the middle of my master's degree where I was working at a group home with a bunch of kids, some at-risk youth, and I ended up getting a phone call from the doctor after some routine blood work, basically that you could have leukemia, and uh, yeah, and you're at risk. Like they were basically like, how are you standing right now? We don't know how are you functioning because your blood levels are so low. So at that point, it was like my whole world was basically thrown upside down. So specifically working with men, I wasn't necessarily like that. That didn't that passion didn't come at that point. But through that time, through my journey dealing with a critical health diagnosis, critical illness diagnosis, it was a wake up call for me in terms of just life and purpose and finding meaning, being disillusioned with a lot of my faith journey and stuff like that. And so it's a bit of a long story.
Yeah, well, I can't imagine going through, you're at a group home working with at-risk individuals, and you're there as a conduit to help them, and you get a phone call stating, we don't even know how you're alive right now and functioning.
Yeah.
We have to get you to the hospital to get you some help. And the words leukemia, cancer, different things start popping up. What went through your mind?
I just started bawling my eyes out on the road. And I just got on the phone with my wife and her family, and I went into a little bit of a shock phase where I didn't believe it was happening, and then I was in the hospital for about a week, not really understanding that this was a really serious thing. I think my mind kind of went into like shock and denial. So I remember just telling my parents, "Well, don't worry, I'll be back. I'll be out of here in a week. Like I'm fine." So I was functioning fairly well, believe it or not. And then they 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 started investigating what was going on. And so for about 9 months or so, I was having to get blood transfusions every single month, every week. And so this is huge for me in terms of like all of a sudden my life, my dreams, all those things were just thrown out the window at that point. Because we had just got married for about a year. So thinking about starting a family. So so for me, that's kind of where my heart for like trauma comes from, because I felt like that's a huge trauma that I've had to walk through.
Yeah, so you were forced to really address the whole definition of mortality the first year into marriage.
Basically.
So what were some of the, of course, now being able to look back, what were some of the lessons that really helped you ingrain of how to live differently?
Well, I think right away we just started to look at how do we support the body, right? How do we support the body? How do we support the mind, right? How do we give ourselves the best possible chance to do well physically? And so with that, we found that through just like researching and looking at alternative forms of health, we found that there was such a connection between the body and the mind, right? And so then we started getting into like holistic, like whole foods and making sure that I was just eating super healthy, just whatever I could to give myself the best chance.
So it
I
sounds like the first
remember
step you took was you changed your diet and what you were eating.
that was a big part of it, right? So I remember one of the doctors even said they recommended going on a Mediterranean diet because I guess um, there's studies around the Mediterranean diet and how healthy it is,
Yeah, I'm hearing
which I
more
had
and more
never
stories
heard
like
before.
that of the Mediterranean, the blue zones of looking at longevity, what we're ingesting, and how it's actually supporting our life system as opposed to the processed fast foods, which we all tend to kind of go after, actually depletes.
Yeah, so Whole Foods, all of a sudden we had this whole shift in how we were taking care of our health, right? And yeah, so I think we really went into like hyper focus on how do we support the body? How do we support the immune system?
So if we can jump in right there, because we have a lot of people will come through with eating disorders as well, and there's a huge psychological shift that happens. So when you went to eating what you want when you want to now, I mean, my life is on the line, and you switch to eating more whole food diet. Was there a psychological shift that was difficult, or was it more of a no, this is life or death, this is incredibly easy?
I think it was easy, to be honest. Yeah, like for me it was easy because you see the cost. Like you see that there's a cost to the things that you put in your body. And for me it was also I had gone through like some bullying in the past too. And so then it started making me kind of questioning like, okay, well, was some of the stuff that I dealt with in the past, has this impacted my body? Is this why I got this illness? So there was a big part of me that was starting to see like, okay, there's this psychological component that has maybe impacted me at a genetic level.
So you started going back to the days of being bullied and looking at, and I forget the author, but it's the body keeps the score and in the
Totally.
more
Yeah.
somatic trauma. And so what was that like as you were navigating that? Was it looking to maybe do some reconciliation, or was it more of like, is this my fault? What was going through your mind?
There's definitely some of it that I think there's a lot of blame on the past that can happen, right? So definitely some anger in there, looking back and going like, okay, well, this must be because I've gone through these things in the past. I think really looking for answers is huge, right? Because from what I've learned with the people that I work with as well, is that we're all searching for some kind of meaning,
Mm.
right? And so then it's like that Viktor Frankl, like I have Viktor Frankl on my wall, right? It's like we're meaning making individuals, right? And so then that's that's what I was trying to do, like trying to question and trying to understand, well, where could this have come from, right? So I think there's definitely a big part of my journey that, yeah, the body was keeping some score for sure. Whether or not it turned on the genetics, or right increased. I think there was a susceptibility there already for this illness, but then I think there was some huge trauma in my life that might have even helped turn that on.
Yeah, there's a gentleman named Bruce Lipton, The Biology of Belief, and really dives into that. So what were some of the findings that you found and how you started to transition? Because it sounds like now you're healthy, you're on the other side of that initial shock and awe. What was that journey like?
What's the journey like to becoming,
Well, going through of asking these questions, and you shared of going to blame and a few other things, and then making it out on the other side. What led you to start making that
you know,
transition?
well, therapy probably for me is a big part of it. Uh, for me, that like I started to work as a therapist, and I got to a point probably 3 years. after my master's. So, did the bone marrow transplant, uh, got my master's degree, then started practicing as a therapist. And about 3 years after that, I started to, all the realities of what had happened in my life started to really come out, right? It's as if all of a sudden all this like grief just started flooding in. So maybe I was protected a little bit, maybe I was holding it off, I wasn't ready to deal with it. And so I was like, I gotta see a therapist. I gotta do some like EMDR work because I heard of that before. So I actually did some of my own therapy, did some EMDR, and I found it really helpful to me. Right. So that was a big part of my journey of healing, was going through that. Um, yeah. So I think that's helped a lot with my healing journey, is working with a therapist and really working through some of those negative beliefs that I developed over the years. Even if it's like self-blame, right? Like there could be some like negative beliefs I have with myself in terms of like having an illness or not being good enough, God's not going to give me good things, all these kind of negative messages that you might receive, right?
So you get the bone marrow transplant, you start feeling a little bit better, but it sounds like grief just starts coming in. And so you find growth through therapy yourself. Is that right?
Oh, yeah, yeah. EMDR. So when you do EMDR training, so this particular training that I did, you practice with other people, right? So a therapist will say, they'll, okay, well, we're gonna just tell me about an event that you can work through, right? And you kind of practice. So you start with something small. So I was like, well, I'm gonna, give them something easy I'm not gonna share my trauma, right? And then, and then you just share something light. They start doing the eye movement and processing, then all of a sudden you're in tears, crying, and you're wondering where these reactions are coming from, right? So then I think there's some signs that like, you know what, Jordan, you gotta work through this stuff.
So through the EMDR therapy, were you able to find the freedom that you were looking for?
I'd say so, for sure.
Can you dig in a little bit deeper on that, of what that process or transition was like?
Yeah, so for EMDR, basically you look at different memories that you've had that have been really emotionally charged for you, that have been traumatic, right? And trauma, the way I understand it, is that there's these memories that are just too big to be stored in the regular part of your brain, in your long-term storage, right? Which is like your hippocampus, right? That's where, we can look back and we can go, okay, this event happened to me way back here. You understand the context and time. But these trauma memories, they're stored a little bit differently in the brain, and they're stored in something called the amygdala, right? So they're very amygdala heavy, which is that fight or flight response, right? And so the amygdala assigns emotional significance to events. And so from my understanding is that I always explain that like the amygdala doesn't necessarily understand context of time, right? So it's as if those events feel like they're happening time and time and again, right? So basically what EMDR does is, as we process through some of those memories, it helps people to consolidate those memories into their long-term storage. So it's like taking it from that like amygdala, real emotional, that triggered place, and then bringing it, helping you put it into that hippocampus, so to speak. So I like all the brain stuff. So it helps me to understand. I really like that stuff. And so what's crazy is that as you're processing through a memory. So the therapist kind of leads you through and they're like, hey, I want you to notice, I want you to picture this event in your mind. You're going to sense, notice how it feels in your body and the negative belief that's attached to it. Because often with these negative memories we have, there's a negative belief that's attached to it. Right? So for this particular, for my memories around the bone marrow transplant, I can't say I know the exact belief off the spot, but it could have been something like, I don't deserve good things.
Mm.
Right? I don't deserve good things, or I'm not good enough, something like that. Right? And so then they get you to process that, they use eye movements. And the eye movements, they're kind of acting like it's kind of activating something similar to REM sleep, right? Because your brain, it's helping your brain to process everything, make meaning, and then it just calms your distress when you think about that memory. Does that kind of make sense?
Yeah, no, totally. So one of the
It's
things
very much so.
that we do here in the center is most things we bring in, I want to test out first to see what it's like, what our clients will go through, and then we go ahead and bring it in. And so we've had different therapists come in with their primary modality of EMDR. So yeah, I'm a huge advocate of it. So it sounds like you start doing EMDR, you start finding the relief, you start living differently, and then this becomes another tool that you look into for your clients. Do you think that because you went through it, you're able to connect deeper and get even better results with your clientele?
I think so. Yeah, I find that if you've done it yourself and you find a therapist who's also done it, it's like there is more, like obviously I've thought into it. So there's like belief there for me, right? I've seen other therapists who are like, oh yeah, well I've tried. Well, maybe we'll try EMDR. We'll see if it works. But for me, I'm like, this is gonna work for you. Like, let's do this.
Yeah. So
Mhm.
at what point did you start finding that your people were men relationships and how to grow and emotionally be able to connect with their significant others?
When did I find that? Yeah, I think like as people work through those traumas, I find it can impact your ability to just feel regulated in relationships, right? And so I find that a lot of the men, so I was challenged to like kind of find my niche a little while ago, and I was like, who am I working with? What's the problem I'm solving here, right? And I found that it was like, wow, there's lots of men dealing with like trauma. They don't know how to deal with their emotions, and they're freaking out on their wives, right? And so then as I work with men and they learn how to identify what's happened to them in their life and work through it, they're able to communicate with their partners better. They're able to recognize their triggers. They can start connecting emotionally with their partner a little better, right? To a point, right? I mean, not all guys are super emotional, so that's but I think overall, just developing a greater understanding for their experience, right?
Is that one of the things you find working with mostly male population is the lack of being able to connect deeply to emotions that actually negatively affects a lot of their relationships?
Oh, hands down. I find a lot of men, their their partners are wanting to feel emotionally connected, and their husbands, they don't understand how to do that, right? Which I think is it's a big part of our culture as men is to be strong, to push through, and I actually believe that that's great in some ways. But then being able to have that other side where you're able to to connect to your emotions and, to identify like what's happened to me, right? And so I, I think it's Gabor Mate says, not, not to say, well, what's wrong with you, but to say, well, what happened to me,
Mm-hmm.
right? And so I think, yeah.
So what are some of the tools that you share with your clients? So if someone's watching this and maybe struggling with connection with their significant other, or maybe they've had some trauma or gotten some negative news, what would you suggest they start doing?
Yeah, like if it's EMDR, I'd say, yeah, I mean, working through some of the trauma that they dealt with, right? I think number one is just acknowledging and taking responsibility. A lot of the work with uh, Gottman, the Gottman method, um, working on things like defensiveness and um, in conflict, learning how to, instead of get defensive, taking responsibility.
Yeah,
You
responsibility
know,
and the repair attempts, right? So important.
um, yeah, if you have issues that you need to work through, and acknowledging it, number one, acknowledging you got something to work on can make a huge difference, and then starting to take responsibility, however that looks like, right? So whether that's doing therapy or being part of a group, right? I would recommend that anybody start, you know, seeking help, right?
So what are some things that get you excited nowadays with all your knowledge that you're able to share that continues to lead you to want to impact this world?
That gets me excited. Hmm. I think a big part of what I want to do is actually create a holistic program for men that encompasses the whole body. Um, so looking at things like physical health, mental health, looking at are they getting enough exercise, what are they eating, kind of focusing on the whole picture for men. That's something that I like doing. The other the other modalities that I like using with men and people in general is something called acceptance and commitment therapy. I don't know if you ever heard of that before.
Heard of it, but not too
Yeah.
familiar with it. What is it?
So that's a lot of what I like doing first is really getting guys to look at their values, right? So thinking about, what kind of man do I want to be, right? What kind of husband, what kind of father do I want to be? And then getting them to look at what steps are they doing to move them towards that right now, right? So that even, yeah, going back to your last question, what can I do? Even starting to look at your values, right? Who do I want to be in this moment? You know, who do I want to be as a man? Like, what am I doing to move me in that direction? I'd say is a big part.
Yeah, like that value driven. So getting clear on your values. And then what came up when you were sharing that is asking a simple question: are your current actions in alignment with these values? And how quickly we get exposed to going, crap, I'm not living the way I want to be perceived.
So, yeah, and if you see like that there's discrepancy there, then that's usually people feel crappy about themselves, right? Like when you're not living according to that, but a lot of people don't even stop to evaluate like what's important to me, right?
So what is a question that maybe I didn't ask, but you would want to either answer or ask yourself so you can share some of that information?
That's a good question. Um, yeah, I guess. Hmm. yeah, I guess, I don't know, my bone marrow transplant journey, I feel like there's so much there. Maybe a question around like, what did you learn from just going through that difficult journey? Maybe would be a good question.
Yeah. So what are some of those lessons you learned?
Yeah, yeah, I'd say I think as a therapist, like going through something really hard like that, like going through like this life shattering event for me has caused a different outlook on life, an understanding of what's important to me. Um, out of all the things in the world, when you're faced with critical illness, I think it gives you a new outlook on what's important in life, and for me, it was family, like family is number one. It's like you could give me all the riches in the world, but that, the importance of family, loved ones, my faith, all those things, right? Um, it was quite a journey. I remember having such a spiritual experience in that journey. Even though there was some trauma within that, there was a huge spiritual component to it that, I came back from that and it was like I was I couldn't hang out with we couldn't go to the same church anymore because we couldn't sit in the same spot because we were like, well, we've changed. We've come back. We're different. We've gone through this crazy life experience, and then my work with people got more passionate. And so if anybody is listening to this who's looking for a therapist, I would say find somebody who's walked a journey, and find somebody who's got the scars. That's my preference. If I work with somebody, then it's like, well, like what have you gone through, right?
Yeah, it's different
So I
when
don't
it
know,
comes from a scholastic standpoint versus a scholastic backed by a lived approach.
right?
So if someone is going through a difficult time, in addition to finding a good therapist, what's a piece of advice you'd want to leave them with?
Say interview the person that you're going to work with. But I also think it the work that you do with a therapist depends depends on your ability to do work as well, right? And allow yourself to open up, right? Because you could have the best therapist in the world, but if you're not ready to be open and to heal, because sometimes we're not, sometimes it's not the right time, then then you're not going to get much out of it, right? And then you come to me and complain that the therapist, you know, didn't do anything.
Back to that old victim mindset some of us tend to go to from time to time.
Yeah.
So if someone's watching this and they resonate with your story, how would they find you and get in touch with you?
Well, they can email me. I'd be happy to answer any questions. I can't work with anybody who's out of Alberta right now, um, until but if I'm doing my coaching side of things, then I'm working on, I can work on, if I'm under the coaching umbrella, then I'd be able to work with somebody, not in a trauma sense, but kind of more in like coaching and that kind of thing. So they could always reach out to me by email. And yeah, so my email is Geordy at imentalhealth.ca. So even if anybody has any questions, I'd be happy to answer any questions that people have.
Beautiful. Was there anything that you want to share that you haven't yet?
Um, Not really. I'd say just thanks for having me because I just want more opportunity to share my story. I think it's important to share your story and because it actually helps me as well to share. So,
Yeah.
yeah, so I appreciate that.
Well, thank you for sharing the story. Appreciate you.
Thanks.